I'd like to welcome all of you today to today's seminar on Jim's book. I'm here today with Jim, who is the outgoing president at the Graham Boeckh Foundation in Montreal. He's been there for the last 3.5 years and will be finishing up there early in July because he just announced yesterday that he is going to be putting his name forward for the candidacy of the NDP in the Westmount NDG riding in Montreal. Did I get that right?
Almost right. So it's NDG Westmount is the formal term, but you got it. It's the West End of Montreal, and I'm really excited to put my hand up to do that.
Excellent, excellent. So now you can, perhaps the next book will be from the politician's point of view on this stuff.
Yes.
So thank you, James, for joining us here today.
Oh, thanks for having me. I'm really excited about the conversation, about the topic, and delighted so many people are on the line.
Wonderful. And thank you to Tamarack for hosting this.
Thanks, Tamarack.
All right. And so without further ado, writing a book is a big undertaking. It's a lot of work. There's a lot of sweat. There's a lot of passion and dedication to make it happen. What made you start this journey?
So yeah, you're absolutely right. Writing a book is not for the faint of heart. There's no question. And I am so proud to have the chance to write this over the last couple of years. It's really a book that is the function of what I call a jagged career. So I'm someone who has run community organizations. The one perhaps that's best known is the Old Brewery Mission in Montreal. It's a big homeless shelter with hundreds and hundreds and hundreds of men and women coming through the doors every day for the basics of life, to try to get through the day. So I worked in homelessness. I worked in government. I was the Deputy Minister for Social Services in New Brunswick for many years, overseeing everything from child protection to autism services, the homeless file itself. The whole poverty file was within the department, not the whole poverty file, but we had the lead for the poverty file. Housing, social assistance, all of those responsibilities were within the department. And now I run, as you say, not for much longer, but I've been running this fabulous foundation created by the Boeckh family many, many years ago to take on the issue of mental health in the country. So there is another area of opportunity for me to study, and in every one of these areas. So if you're putting your hat on, you're thinking, and you have some responsibility for the designing and the implementation of programs, budgets, even laws as regards these areas, you start to ask yourself, well, what's working? And you roll up your sleeves with your teams, and you figure out what is the best thing to do. And inevitably, in all of these areas where I had the chance to work and the chance to read, the chance to implement, early intervention was the answer. Early intervention really became for me the golden thread that tied best practice in design and implementation for all of the health and social services that I've been involved in, and others that I haven't been involved in as well, which I was able to study for the book. So at the end of the day, I thought that needed to be said, and in some ways it's somewhat intuitive. But what are the stories? What are the research? What's the argument to try to create a new dynamic, a new habit in terms of the delivery of social services in our country? That was it.
So, in fairness, not an entirely new idea. I mean, in the book itself, you even say, it's as old as your grandmother saying an ounce of prevention is worth a pound of cure. Getting up in front of something is really how we solve it and prevent stuff from happening. What happens in government that stops that? Why are we habitually, systematically late to the party, late to getting there, fixing the problems that have resulted because we didn't do the upfront work? What goes wrong there? What's the systemic failure?
What's the disconnect? Yeah. So historically, and this is all argued in the book as well, and I invite people to have a look at, because this is not only what I'm going to say now. There's other parts to it. But so historically, there's a couple of really strong factors within government that have put the brake on what I would call really progressive early intervention thinking. And this goes back to the start of the welfare state back in the 30s and the late 20s, is this idea that, first of all, the individual and the family should be the primary movers as regards the care for their own or the care for themselves. So there's this dynamic that is still true to this day, that government should be there, but only for those who truly are in a state of emergency, because they clearly have not been able to take care of themselves at the front end. And we should not deny them the chance to pull themselves up, pull their, and have that that opportunity to have overcome an obstacle. So that's one big one. The other big one, I would say it's even bigger, is this idea that, and this has always been the case in Canada with some exceptions, is that we have scarce resources. That we don't have enough to do everything. We can't go upstream with all of our programs and downstream with an emergency program. We've got to make a choice. So what is most important? Well, most important is obviously intervening when people's life, people's health, people's safety are at imminent risk. So that has political implications as well, right? Because the last thing politicians want to do is be told, be accused that emergencies are not being taken care of. It makes a certain amount of sense, right?
But it puts us in crisis mode.
So we are always in crisis mode. So not only, does this fit with this kind of sense of a bootstrapping population that needs to let, individuals and families take care of itself, it also, within an environment of scarce resources, puts us where apparent emergencies are. But what it doesn't do, of course, is really solve the problem in a way that is not only good and appropriate and right for families, but actually ends up being less expensive.
So do we have evidence around this that if we just make the investments up front, whether it's in a child's first 1,000 days or whatever it might be, that if that early investment is made, that we see those savings over the long term? Do we have evidence that works?
So this is what the book really is about. This is the proposal. This is the proposition in early intervention, is that the evidence is now in place to a large degree, not only about the social, physical, the health outcomes that are improved by intervening early, and we can maybe go through a few examples in some of the social service areas we mentioned before, but the economic argument is now available to us as well. This is fairly new. So, if politicians have been accused in the past of closing their eyes to the economic opportunities that come with early intervention, they really can't anymore, because to a large extent, the case is now being made. We're going to have to make it increasingly in a more refined way, in a more precise way, but we do have the economics for arguing, for instance, that intervening early in child protection with families at risk is a great investment. Remember, we live in general in an environment where investment is a positive thing. It's seen as positive when it comes to repairing bridges, when it comes to repairing roads, when it comes to repairing physical infrastructure. And we say, well, if we put in money today in those areas, let's do the cost calculation of the lifetime of the asset. What's our return on investment? That's the language that is used. And what I propose in early intervention is that we use the same kind of logic, the same kind of math to say, well, what are the returns on these investments we're making in human capital and human assets?
So often, though, we think of government spending on the social and government investment on the hard and infrastructure.
Correct.
And that twigs so many different assumptions in how people see it. Spending, you don't see it as a return on that spending.
Right. And it's don't want to go too long on this, but it's hard to be a politician, right? You have immediate political needs. You have to get certain things out the door, like an annual budget. You only have 3 or 4 years in a political mandate. So these make it very, very tough on politicians and their senior civil servants to really bring reform.
Well, and this was going to be one of my questions next. Is sometimes you see the return on investment of investing in children, and it's a 15-year trajectory before you see the return on that. or you see complex returns on the investment. So I think of, incarceration. So you prevent someone from going back into the prison system because you've put the right investments in their exit from the prison system, and you can claim all kinds of savings to the criminal justice system, to the health system, to the so on and so forth, but those don't get distributed necessarily right back into the coffers. So it's harder to make that argument.
It really is. I really love your term, complex returns. See, that's part of the problem. The returns on investments in humans and in communities are very hard to quantify, and even if they are quantifiable, the problem is they get dispersed, as you say, across a whole variety of different areas.
Right.
And we still work in government in a very siloed way. This is my Department of Social Services. What's the impact on my budget in this fiscal year? Because that's what is expected of me, is to hit this target. And so any investments I make, I better get them back. But that's the kind of thinking that I think we can really improve on. There's really one provincial budget, and that's the Premier's budget, right? It's the people's budget, but ultimately there's one Premier's office, one Executive Council office. They have got to figure out at the center of government where all the returns are, and help install this culture that says, yes, if you make investments in the correctional services, it's the health department that will save, but we're okay with that.
There's also the challenge of short-termism. We live in a world, a political reality of 4-year terms. And so sometimes seeing a return that happens after a 2 or 3 or 4-year window, you don't get the benefit. Your political capital doesn't benefit from it. So that's another.
Absolutely, that short-termism is really tough. But we're starting to see, and I mentioned the child protection example before, is that in the example I give in the book, the returns actually, if you do good, high quality, and that quality issue is so important, early intervention with families in distress, where there's not an imminent danger to the children of abuse or neglect, but there's problems. You're getting reports. I mean, governments, they know in child protection often when there's a problem. They just don't give themselves the toolboxes and the resources to do anything about it until it becomes an emergency. But we do know now that based on the New Zealand example, and now in Brunswick, Manitoba, and many others are adopting this, Ontario, that early with families in distress, you can actually start to see the payoff in reduced foster care bills, reduced litigation costs for all that code red social work that's done as the rule right now. You can get some of those savings within a year or two. You can really start to see the numbers go down. In New Brunswick, when I was the deputy there, we saw within 1 or 2 years a 20% reduction in those costs, which paid for all the early intervention in family conference, kinship care, and so on at the early stage. So you can get some early wins, and that's what I propose is, if you're thinking about which early interventions to start with, if you want to start to, start a wave of cultural change in your practices, start with that lower hanging fruit of quick early intervention rates.
So we have a community of practice online that is interested in poverty reduction. Can you bring this home to what does this mean for those of us who work in trying to reduce poverty? What are some of the examples of early intervention yields great results?
Great. So the poverty field is a great example, and a full chapter is devoted to it in the book. And really, I talk about the story of my friend and I think a New Brunswick hero, Juanita Black. And Juanita is someone who's, I won't tell the full story because I invite readers
buy the book
to read it, but she's an amazing lady, and she basically left high school, got pregnant, and found herself on social assistance for decades. And why is that? It's a question I kind of throw out there. Is was that a really good idea for the province of New Brunswick to sit reactively in its governmental offices and not provide a kind of more proactive approach to try to help Juanita think through some of the options that she increasingly stopped thinking about for herself, right? She said, I got in a rut at one point, and you understand that. So, that whole, as I talked about before, that bootstrapping approach, well, come on, get up, come on, you can do it. Well, you know what? That's hard. That's hard to do. But what if you took a different approach, an early intervention approach, and when someone hits the welfare office, you say, you know what, let's sit down, let's figure out, no one intends and wants to be on social assistance. On a transitional basis, sometimes that's necessary, but that's not the purpose of this program. The purpose is actually to get you back on the wire of your life. So what I asked in the book, well, what are some of the great early interventions in poverty reduction that might have helped Juanita? It's all really quite speculative, of course. But I fell on an absolutely magnificent program, which I'm sure all of your listeners have heard of, which is Quebec's early childcare program. So you don't immediately think that's about reducing poverty, early childcare. I thought it was about childcare. Well, it is about childcare for sure. It's about breaking to some degree cycles of problems that sometimes occur in families where there's exclusion from community, exclusion from opportunities for connections. But what the Quebec research is now showing is that it's an amazing poverty reducer, especially for women and more particularly for single moms. So let me give you some of the stats. The program, Quebec's $5 a day program, so making childcare affordable. We know today that childcare often costs more than your rent, often costs more than your mortgage. It's so expensive. So what Quebec said was, I'm simplifying somewhat, but what if we made it $5 a day and the state will pay the rest? Is that a good idea? And they started somewhat slowly, but by 2008 or so, there was about 45 to 50% of the population had access to affordable daycare, and that's still about the case today. We still have quite a ways to go, but what were the results for that 50% of the population that now had access? So first of all, there was, in 1996 when this began, there was approximately 100,000 single mothers on welfare, on social assistance, just like Juanita was. By 2008, when they actually did the study, that had dropped to 40,000 people. So almost 55 to 60% reduction in social assistance. That's a reduction in poverty. If you're on social assistance, you're necessarily living in poverty. What affordable childcare gave to these single moms was a highway to the economy. That's where they wanted to go, and that's the road they were now able to take. And this is not to say that those moms who want to stay at home with their kids, that there's a problem with that. Absolutely not. The purpose of this was to give a choice, an option for those families who wanted to have attachment to the economy tax. So the overall reduction in the poverty rates of single women in the province went down by 25%. So that's not just people on welfare, but others who are also living in poverty. And then you say to yourself, okay, great, poverty is going down directly and immediately because of this. The employment rate for women in the province went past Ontario's over the same period of time because of affordable childcare. How interesting is that?
Yeah.
But what about the cost? $5 a day means so by 2008
someone's paying.
Someone's paying. So taxpayers are paying. So
yep.
Spread the cost of that additional amount around the whole tax base. It ended up costing $1.7 billion, or $1.65 billion. I'll tell you why I remember that in a second. $1.65 billion by 2008. But then they did the math. This is the question you're asking for. Well, what are the returns on those investments? Are there any? And they started to look at the reduction in social assistance rates that I mentioned before. That's cash in the government's pocket. But much more importantly, all those people, specifically women, and many single moms, now going into the economy, guess what they're doing? They're working, they're paying tax. So the research group actually calculated, well, how much tax are they actually paying? Well, the combination of the tax they were paying plus the reduction in social assistance rates added up to $1.7 billion. So it paid for itself and a little bit more.
Right.
And we reduced our poverty rates by absolutely ginormous amounts.
And we're not even capturing the other ripple effects of that.
the ripple effects of actually kids being in high-quality daycare, and I'm not saying all Quebec daycares are of the highest quality. We know that many of them continue to need support, but most of them are doing really well. The payoff in that is over that longer term.
That's right.
But that complex return, I really like that expression. I'm going to use it. So this is a gift that keeps on giving.
Yeah.
Yeah.
Well, and then you also look at the stability of the family, the value of that the women have in being contributing and earning and the self-worth. There's all kinds of additional benefits that we're not even able to capture in simple econometrics.
We didn't try to capture in the study, but we should get, and we must get more sophisticated in capturing that as we go forward. If we're going to actually install a culture of early intervention, we need more data points than we actually have today.
Now, Jim, I know you've also worked, as you said, in Montreal on the grassroots, and one of the great things about your book is that you go from a perspective from the ground, and the people that you met, the Juanitas, the characters, the personalities and the lived experience of poverty, to the 25,000-foot view from being a deputy minister. From the ground level, you had an up-close look at homelessness in Montreal. That's perhaps our most graphic sense of poverty in the country. What are some of the early intervention points there?
Yeah, so thanks. So yeah, the homelessness file is another example where, in fact, Canada is actually generating the kind of evidence the world is now relying upon for reducing homelessness at a cost that's right. So everyone knows the $1 Million Murray story. So maybe not everyone does. Very quickly, this is a Malcolm Gladwell piece, which I talk about in the book. It's probably the great seminal article on homelessness and why it's such a bizarre phenomenon, right? So we hit big homelessness by the mid-90s, and we stayed up in that big homelessness area. It used to be very small and manageable in the past. But now, I mean, these institutions, the Old Burning Mission, such as when I ran Calgary Drop-In Center here in Toronto, the Seton House, these are massive institutions, some of the biggest mental health institutions in the country. This big influx of people, we're not going to talk about the reasons for that, but what do all people coming into a homeless shelter have in common? It's a loss of housing, a loss of income, and a loss of relationships, right? Because they have nowhere else to turn. So what we've done traditionally in homelessness is we've let them, hey, come on in, stay as long as you want. You can have, you can call this place your home. You can create relationships here within the shelter, and you can go down to the welfare office and collect your check, and that's better than it was. So that was enough in the day. But these organizations have got so big now, including the one I ran, that people started scratching their head. Are we just going to get growing and growing and growing, get bigger and bigger, and just do what we've done in the past? Give witness to despair, witness to poverty? And the answer now manifestly is no. We have to do something different. We have to intervene early, was ultimately the answer. So when people hit the door now, they're not homeless yet, right? When they come to the shelter door. So my friend Matthew Pierce at the Old Burning Mission, he'll say, well, you're not coming into the shelter at all. We've got this other facility, this other program and process to help you immediately identify the housing you need, immediately make sure you get basic income that you don't have, and start to help you develop the relationships that you need to get back onto the wire in your life. So homeless shelters are now, and it's not just the Old Burning, it's others, are really starting to intervene early. The research is showing that taking the at-home chez soi model that some people on the phone, we can talk about more of the details, but this is, they actually researched this model where instead of letting people linger in homelessness, that we immediately provide options for housing in the community, get them in. Now, what is the cost for that? What is the cost for the housing? What is the cost for the supports? It turns out for those men and women who are living chronically in homelessness, it costs a whole bunch less to give them a house and give them the supports they need. The $1 Million Murray story, he's called $1 Million Murray because over a 10-year period, living in this more traditional way of homelessness, in the shelter, out of the shelter, in the prison, in the hospital, it cost the state of Nevada $100,000 a year. So over 10 years, he became $1 Million Murray. So that's the case for intervening early in homelessness as well. at the earliest.
There's so many examples of that. One of the ones that we've come up against here is working with youth being held in detention and the numbers of years that they can be sort of languishing in that system. And the cost of keeping one youth in detention is roughly 60 to 100,000 a year. It would be better for us to send them to Harvard for a year and think of the return on that investment.
Imagine the return on that investment. And we should do the math on that investment.
Absolutely.
It may end up paying off. What I say, if I may, sorry, one of the things it's a function of having been in social services. So many on the phone, people on the phone like that. You can never give up, right? You can never give up on people. So even if the child protection system didn't work,
yeah.
Even if the health system didn't work, even if the education system failed people, even if the all the other supports you gave, people kept slipping and they hit the homeless shelter, it's still worth it, not just morally but financially, to intervene right then so they can stop falling any further. That's what an early intervention mindset is to never give up. It's never too late. Intervene early is what I say.
So how do we make that happen? How do we make that shift and start being a society, a government, a community sector that supports and endorses and lives and breathes early intervention?
It's probably the toughest question, and it's one where there'll be different opinions, and we may all be right on what needs to be done. But what I put out in the book is two methods to contribute to this cultural shift that we need. The shift to a habit of early intervention are, first of all, and from two different perspectives. One, citizen engagement. So we've seen success in social change when citizens, patients, families got organized with simple, powerful messages and relentlessly went about seeing the change. And the example I give is about the massive tidal wave of change we've seen in HIV/AIDS and the types of responses government actually finally had to give when the community that was most affected by it simply did not back down. And so I think we have to think about how citizens in each of these specific areas where people are passionate, whether it be an autism file or whether it be which is another long conversation, in the school violence file, that we start to see parents, or we start to see patients, we start to see citizens actually get truly organized with simple, powerful messages. Mental health is another perfect example of that. It's an area where there isn't coherent, simple, powerful structures and organizations to get messages across. The other example, the other method, I should say, that I talk about is my experience in poverty reduction in New Brunswick, and I call it bipartisanship. So we talk about the problems, the political problems of short-termism, the political problems of scarcity, and I say to myself, well, what can we do that actually can overcome some of those things? Well, what if political parties actually agreed in the area of poverty or in the area of social services more generally? Let's treat that differently in terms of our political negotiation, our political combat, than we would, other areas where we have profound disagreement. I mean, I put to you that people on all parts of the spectrum agree we should have less poverty. That's just one example. So if you can actually come to an agreement on the objective, now we may fight over how we do that, but let's take the time necessary as collaborators and try to work through a longer-term plan that, if you beat me, it'll be your program anyway, and we'll carry on, because that's exactly what happened in the poverty file in New Brunswick. The Sean Graham Liberals lost in 2010 to the all-work Conservatives, but because they had worked together on the poverty reduction plan, actively in the design and implementation of it, the all-work government simply just carried on with the implementation of the plan without losing a beat. And that wasn't an election issue. It was treated differently to the normal gravity of oppositional politics. But that's another way maybe we can start to think longer term about how to install this culture.
So take the politics out of the issue so that everyone can live with it.
Yeah. But it's not so much to take it out of it. It is actually to because I could have called it nonpartisan. But it's actually a political decision to work together on this. But you're right. It's to treat it in a politically different way.
Right. Not make it divisive. So engaging citizens. I'd like to hear a little bit more about that. So that's about creating constituency and making government pay attention. Now, you've been on the side where you're the deputy minister. What would turn your, I mean, there's turning the politicians' heads, and then there's working with bureaucracy. Are they different strategies? How, this is, you're speaking to a group of people on the ground who are activists, who are engaging their communities, who I think consider themselves the engagement leaders. How do they approach this effectively to become a constituency that is heard? Because you can make lots of noise. You can make all kinds of noise, and you might even make a headline one day in the newspaper. You might even get to the front page of the Globe and Mail. But if you don't have that stick, that sort of glue, that you kind of stay on the radar and you become a priority for a department or for a minister. So maybe some words of wisdom from your experience.
Yeah. So they're different, but they're related. This is just my experience. It certainly will be different from province to province, and frankly, issue to issue, and maybe even department to department. But the civil service are people just like you and me. Right? I mean, they are people who want to make a difference. But they work within a context. They are called civil servants for a reason. They serve their political masters. Governments come and governments go. The civil service, to a large extent, stays, and it has to be disciplined to make sure that it is not going offside what the political program is. But there are lots of different ways to go about articulating an objective, whatever the government may be, with a given civil service. And having that dialogue is important. Asking honest questions with directors and assistants, deputy ministers, managers, about, okay, well, you know, we have this objective and what we want to do, and you pick the file, and poverty file with welfare reform. We want to make it more effective. We want to make it more effective for these specific clienteles, whatever your agenda is. Ask those civil servants honestly, like, how can I start to articulate this in a way, how can I prepare my brief in a way which is responsive to the political agenda that you are having to implement by politicians. So I think having that honest conversation, they want to get things done too. They often are finding it difficult. They're often finding obstacles themselves to moving files forward, but they have to move at the speed of their government. So at the same time you're working with civil service, I think groups have to also work with the political class as well, and not obviously just with the politicians themselves, with the politicians' staff, the politicians' advisors, working in individual, more perhaps important riding associations where these issues come up, and whether that person be a backbencher or whether that person be a minister, actually make sure that they're hearing about this issue, the importance of this issue, from that angle as well. And of course, trying to get in and speak to the minister and having frank discussions with them as well. I mean, they want to move files forward too. Like I've found so often in my travels that people really do, whatever hat they're wearing, you know, they want to have a legacy. And sometimes it's just really hard because there's so many hands in the jar. There's so many competing constituencies. That's why if you're going to one or the other, that's the civil service or the political class, it's best to go as large of a group as possible. If you can take a sector approach as opposed to an organizational approach, you're much stronger, number one. And if your messages are simple and doable, you're much more likely to have some success than if they're, you know, both competing and highly complex, requiring changes. Everything you can imagine, from legislation to regulation to budgets and so on. So those would be some of my observations and some of my thoughts.
So build good partnerships, be strategic, be helpful.
Absolutely.
Don't go in with a laundry list of 142 things that would that may not be possible.
Yeah. And when you're in that meeting, make sure you let them do some of the talking. So often, you know, sitting there in the room and listening to these incredibly well-meaning people with tremendous stories to tell, individual stories, it's captivating. I mean, I did it myself, right, on a couple of different of these files. But make sure you give yourself, if you've got an hour meeting, if you're lucky, make sure you present for 20 minutes, 15, and make sure the rest is about asking questions about, you know, where they're at on this. You know, are we framing this in the right way? Is this the right way to express what we all know needs to be done to help this particular community or demographic in need?
I'm just going to put out an invitation to the people on the line. We're absolutely interested in hearing what questions you may have to ask. I can ask questions here all day. I'm having a great time here with Jim, but I also don't want to hog the dialogue. So anyone that has a question, please be sure to send that in. In the meantime, Jim, I want you to just think back on the process of writing this book. And you spoke from some of the experiences you had directly and told those stories. You wanted to get those stories out. You also sort of began to research and find out other stories. What were the greatest surprises that you came across, or what was the sort of the most? Were there any aha moments, or wow, I'm shocked and impressed by that, or what was the standout for you?
There was no real shocking moments. I mean, in many ways, I've been writing this book in my head, as so many authors, I suppose, have been writing it for a long time, much longer than I actually did write it. But it was just this matter of, well, okay, you know what? It's so interesting in this child protection area that early intervention is the way to go. And I remember Mike Doolan, this amazing social worker leader from New Zealand, actually coming to advise us in Brunswick about our own reforms and how to go about it, and you know, using the language of early intervention. Well, isn't that interesting? Because I just heard the language of early intervention being used at the entire other end of the spectrum. You know, in another file on homelessness, where you know the at-home chez soi file, the housing first model, was really considered as an early intervention. So for me, the part of the exciting part, which was the hardest part for me, kind of like the research and the statistical models and the economics were kind of natural to me to kind of put together. It was the stories that were the most exciting part, because I interviewed a lot of people, many of whom I knew, and I knew who had been through the system and faced a lot of problems. But some of the experts I didn't know as well, and to hear their stories and how this all seems to fit together really quite coherently as a whole is really probably, you know, what I intended. But I mean, thank goodness I had such a good publisher. You know, I've never written a book before. I had a different title for this book. They said, no, we're not going to go with that title. We're going to go with a different title.
What was your title?
So I originally, because for me, the whole, I had two different titles. The first one was The Welfare State 2.0. Like this is that big. This is, you know, this is the next 100 years are going to be about this, because I personally think early intervention can make the social service system much tighter, much smaller, more effective. You know, we don't need so many of these big, massive institutions that we have, these massive hospitals, massive homeless shelters, massive correctional service institutions. If we intervene early, I think overall and over time, it's going to be much lighter, much more effective, much more nimble, much more natural than we have now. I really profoundly believe that. So that's why I thought welfare state, like this is going to be, I knew it's going to feel and look totally different. Not a bad one. They didn't like that one. So the next one, so the idea is that really our social safety net is really low, right? So that's the image. So the social safety net is like a circus wire, or like a net sitting under a circus wire. So if you can picture that, and what our social safety net now does, unfortunately, is let people fall so far that they're so far down that they can't reach up and get back onto the wires of life. And if you look at social assistance in the poverty file, you're getting $650 a month if you're a single unattached person.
Not doable.
Not doable to get back up onto the wire of your life.
Not doable to keep going.
Yeah. So what if the wire instead, or the net, I should say, sat right underneath the wire, as opposed to a low net? What if it was a high net? because people fall all the time. We have to be able to have the supports and structures in place for people to be caught and accompanied on the voyage back to the wonderland. So my second title, which also the publisher didn't like so much, and quite rightly, was the high net. So it's a high social service net as opposed to a low one. And they thought that people would think it was about circus performances or something like that. So in the end, they just said, well, why don't we call this what it is, which is early intervention. So they'll going through the actual writing process was very exciting too, and that was just one example. Yeah.
Interesting. The big challenge here is getting government to change its mindset, to go toward the early piece, the early investment. Are there ways that we can help move that along from outside? Like we talked before about, sometimes the innovations of early intervention get different kinds of support to make them happen, and then once they have a bit of a track record and proven, then they can get incorporated into policy. Is that another strategy that we should be thinking about?
Absolutely. I think the role of philanthropy, the role of the nonprofit sector, the role of the business sector can be really exciting here. Ultimately, they have the opportunity to, as you say, demonstrate success to the extent possible, and in terms of scaling up and scaling across constituencies and jurisdictions. You'd see the government in Canada anyway having normally a big role in that because of their legal obligations. But absolutely, the testing, the trial of some of these ideas is, I think, really an exciting opportunity. And just before we came on, we were talking about social impact financing. And I do blog about this. Very short blog I did about this a couple of weeks ago was that I think potentially one of the ways to lever into the new age of early intervention is through social impact finance. And so many of the foundations, including the ones I run, including the one you run, we have a lot of assets sitting in regular market investments that are not furthering our mission. I mean, we need to get a return because we need to generate enough money that we can meet our legal obligations under the law, the 3.5% of our assets spent every year. But what about the other 96.5%? Is there any way that we can start to think about using those assets into mission-related type of work? And I think we're just at the start of that. We all know the great example of the Peterborough Correctional Services example, where private money put investments into place to try to shorten the time that young offenders were actually staying in prison, because that's costs a lot of money for young people to be in prison. And the faster they get out, the faster they get back into the economy and back to contributing to their families and their communities. And so a whole investment vehicle was set up whereby private money went in to test this idea and to see what kind of money government could save. That's essentially the purpose of this. And the trial is still going on, I think, but largely it's showing that there's very interesting returns. So much so that the government of England, I think it's of England, is now starting to pay back some of those original investments because it's been proven that this is a better way to go. So there's just one example. I mean, in my foundation right now, we're investing in a big trial of new mental health initiatives for youth across the country, 12 sites, all based on early intervention principles. Let's get those kids who are hearing voices or feeling depressed as early as we can, work with them and their families on evidence-based ways to make sure that they don't become more severely mentally ill. And what are the savings that are generated from that? So a lot of health economics work is going to go into that, but that's just the start. We're doing that in partnership with the federal government, which is an interesting ally to do this with because we're going at it through research. But the ultimate beneficiaries are the provinces. If we can actually show this saves money, saves time, increases productivity, increases quality of life, I think it's one to watch. We do insist in each of the 12 sites that the provincial government does be involved, at least to watch, investigate if possible. And we're hoping that that kind of knowledge translation model, where provincial governments are actually engaged as well, although not to the extent they might be in the future, I think is the best way to go about scaling these over the long term.
Yeah, Just a follow-up to that, what Jim was describing in the Peterborough example, and that's Peterborough in the UK, it was sort of the classic social impact bond, and that has really proliferated now. We see them in Australia, New Zealand, all over the UK. I think there's like upwards of 30 scattered across a number of different issues: homelessness, young people sleeping rough on the street, interventions for youth, all kinds of workplace things, and so forth. The fellow who was sort of the author of social impact bonds, Sir Ronald Cohen, I heard him speak, I think last year or the year before, here in Toronto. And one of the most important things I heard him say was, this is all well and good, but let's make sure that whatever we learn at the end of the day, it gets embedded in public policy. It's not a never-ending investment, a private investment. It's in some ways a private-public partnership for people, the P4, if you will, of investment. But at the end of the day, we should have a parallel process that is changing public policy so that it gets embedded, so that early intervention becomes the way that we deal with it. So it's completely...
Ronald Cohen for world president.
So we have a question from Paul Bourne. He wants to know how our province is working differently to consider these ideas. Do we see differences across the provinces? Is it kind of chugging along at the same way across Canada, or are there differences?
So great question. Thank you, Paul. The provinces are taking on poverty in a different way. One thing they aren't taking on in a different way, what they're doing quite similarly, is they're actually taking the time to develop poverty reduction strategies, which I think is a really good idea. You know, to have poverty reduction strategies where all constituencies from, you know, government, business, nonprofit sector, people living in poverty, actually coming together to have that discourse around what the priorities should be, I think is generally really favorable and should be lauded. We have, I think, all the territories and 8 of the 10 provinces have poverty reduction strategies now. And really quite a big positive, I think, change in the country over the last few years. Chapeau to Tamarack for its huge role in that regard. But when you look at some of the plans and you look at some of the priorities, they do look different from province to province, and that's probably a really good thing. In Quebec, as I mentioned, early childcare continues to be really at the top of the list of ways to reduce poverty. You know, expanding early childcare as far as possible would be, you know, the dream. Because of severe budget cuts in Quebec, we're not going to probably see that anytime soon. So that's definitely one to watch. In New Brunswick, where we developed poverty reduction, really there was some emphasis on early learning, but I'd say the bigger emphasis was on welfare reform and attachment to the workforce through training initiatives. And other post-secondary types of initiatives. I think that was probably, you know, if I had to pick one big priority, that was probably it in that province. And other provinces will take these issues on in a way which is appropriate for their environment. You know, we're going to watch, hopefully, the Alberta government start to go down that road as well. And I know nationally, certainly a couple of the parties are looking at national poverty reduction strategy, and how nice would that be to kind of align with some of the work that's being done in the provinces and the territories. So we know that from a Daily Bread research report a couple of years ago that those provinces, with one exception, that do have poverty reduction plans are more likely to reduce poverty than those that don't. So, and the point is, you know, if you get organized to do something, if you start to take something seriously by doing good engagement, by doing good public policy, by actually putting budgets in place, working with communities to deliver some of these things, you're going to get a better return than if you didn't. I mean, the Ontario $50 million Poverty Reduction Fund is one to watch as well. I think there's lots of talk about the parameters around the spending on that, trying to, you know, I think I heard the minister talk about developing an evidence base that doesn't exist today.
Yeah. Lots of emphasis on collecting data. The evaluation had a very important role in the call. I didn't see an early intervention lens on the call.
I would say that's something that we can hope for in the future.
Yeah, so that's the future-looking direction.
Yeah.
Are there any other questions from the group? If not, then Jim, I want to give you a chance for sort of a last sum up, thinking about who we have in the room, our virtual room of people from communities who are working really hard to figure out how to move the marker on poverty in their communities. I mean, I definitely say this is a book worth reading. It's full of examples and ideas, and it gets your mind going. It gets you. I was having all kinds of arguments with myself as I was reading through different chapters. So what are apart from reading the book and maybe getting some discussions going locally in your community, do you have some final thoughts?
Yeah, what I would say, thank you, as a final thought is that when I was at the Oldbury Mission, the organization, took that long, I think a sufficiently and appropriately long period of time to say, what are we in the business of doing? And I know this was the case in the food sector as well, if I can call it that. There's a lot of this contemplation going on now. And it didn't take government to tell those sectors, those organizations, to start to think about doing their business differently. I guess what I'm trying to say is, and as a concluding remark, if we're going to ask government to start to intervene early as a cultural requirement, almost as a moral and maybe even a legal obligation, if you have the evidence that it works better and you save money, how can you not do it? I mean, as we'd say in French, ça me dépasse. Sometimes when you make that clear case, the evidence is clear and compelling, and yet there's stasis. But to come to government and have that conversation and be able to say, look what we're doing in our sector, look what we're doing in our organization, according to the very same principles, because organizations like the Oldbury, they can do better. They're doing great now. It's just a success to success, but they can even intervene earlier. I think the future of homelessness, to a large extent, or homeless organizations, is to become home support organizations. So that is so they can intervene even earlier than they are now. I'd say every organization can intervene earlier than they are now if they actually put their minds to it, strategically plan it, and start to move in that direction, whatever the government may say. Now, how wonderful would it be for the government to support them in those efforts? Community organizations are, to a very large extent, the arm or the agent of government, because they're funded to do these things, if not in whole, in part, by government. But they do have the autonomy, the authority to move forward and make those changes themselves. And I would encourage them to do it at the earliest time possible.
Wonderful. Inspired. Okay, so we're at the time that says that we need to move on to our closing announcements. Thank you, Jim, for joining us for today's broadcast and sharing your expertise with us. This has been incredibly insightful, enjoyable to hear about the process, and more than anything, thought-provoking about what do we do in our own practice and how do we take that forward. Thank you to all of you on the line who joined the broadcast today. In a few days, Tamarack will email you with links to the audio and other material related to today's call. Please email Tamarack at tamarackcommunity.ca to let us know what you thought of today's broadcast. And you're also encouraged to check out Tamarack's other online and face-to-face events on their homepage at www.tamarackcommunity.ca/events. Of note, Tamarack will be running their annual 5-day signature Collective Impact Summit event in Vancouver this September 28th to October 2nd. I think that's a nice time to be in Vancouver, very thoughtful of Tamarack. And early registration is encouraged as this event fills up quickly. You can email Carrie at tamarackcommunity.ca for more information. Again, thank you to everyone, especially to the team at Tamarack, for making this so easy and just a pleasure to be part of. Have a good day to everyone, and thank you.